Hey everyone! We are back with another Wellness Wednesday episode, and today we will be discussing heart failure. Heart failure is a condition in which the heart ceases to function. It is fatal for the heart to be in this state. Heart failure includes a variety of illnesses that in severe cases can be life-threatening. This condition is a mask for various questions surrounding how the heart is targeted, develops symptoms, and how these symptoms are treated. Heart failure occurs when our heart muscle fails to pump blood effectively to the tissues, which causes the blood to circle the body. The built-up blood eventually causes fluid to build up in our lungs, which will affect one's breathing. As a result, one's arteries narrow and the heart is weakened, and our blood pressure will be severely affected. All heart failure patients follow a very unique treatment plan that is tailored to their specific needs. This is because heart failure affects every patient in a different manner. These specific treatments are determined by cardiologists, which are doctors who specialize in treating diseases related to the cardiovascular system. Some symptoms of heart failure include shortness of breath while performing activities, feelings of fatigue and weakness, and swelling of the legs, ankles, and feet, which is pretty much all of your lower extremities. There are certain illnesses that can worsen heart failure symptoms. For example, heart failure patients diagnosed with diabetes need to be treated with a dose of glucagon during heart failure treatment. In addition, if someone is hyperglycemic, then they will experience extreme thirst, urinate frequently, have blurry visions, and feel abnormally hungry. They could also start to experience ketoacidosis, which is when too many ketones try to act as a replacement fuel for glucose. This causes the blood to become acidic. Ketones contain fatty acids from the body and eventually cause shortness of breath, sudden weight gain, a dry hacking cough, bloating, upset stomach, the loss of appetite, and many more symptoms. Potential cures. Heart failure symptoms can progress fairly quickly depending on the cause. If the heart is susceptible to a heart attack, symptoms can appear within hours. Meanwhile, if the heart is infected or exposed to an illness, symptoms can appear in days and or months. According to the CDC, heart failure is a leading cause of death in the U.S. About 670,000 Americans die per year due to heart failure. In some cases, heart failure can be misdiagnosed due to symptoms shared by various illnesses. This isn't a common occurrence, but it can happen. Heart failure is often confused with kidney disease, as both of them involve fluid buildup in the lower extremities. In addition, some illnesses lead to the development of heart failure, the main illness being coronary artery disease. This involves the buildup of plaque in arteries, which limits the amount of oxygen entering the heart. Potential cures or treatments vary based on the stage of the heart failure. During the first few weeks, exercise and medicine may help, but when your state of health starts to worsen, surgical procedures become a possibility. Treatments also vary based on many different factors, one factor being how well you take care of your health. As for tests, they can help determine what stage of heart failure you are currently at and what caused it. Common tests include blood tests, BNP blood tests, cardiac catheterization, which is a procedure that involves a tube being sent through the blood vessel to the heart, and this procedure can diagnose the heart conditions. Also chest x-rays and a stress test. Non-scientifically proven treatments include being active daily, reducing the use of tobacco products, reducing alcohol and reducing recreational drugs, and investing in a low-sodium diet. There are also a few cultural treatments for heart failure, the main being homemade remedies used in an effort to lessen symptoms such as of a weak heart. For example, some may believe that taking vitamin K daily is necessary to keep one's heart healthy, even though this hasn't directly been proven. Scientifically proven treatments include using a beta blocker, which is a drug that widens the blood vessels if you have high blood pressure, for coronary artery blockage, heart attack, valve disease, or congenital heart disease. Heart surgery or intervention are considered as possible treatments. There are many possible complications that heart failure can cause. One of them is kidney damage or failure. This is because heart failure reduces the blood flow to your kidneys, which will eventually cause kidney failure if left untreated. Kidney damage from heart failure can require dialysis for treatment. Numerous risk factors of heart failure include hypertension, diabetes, obesity, sleep disorders, and many more. In addition, one's diet plays a large role in the development of heart failure. With more and more fast food and junk food being produced and sold, heart failure is thought to rise significantly in the years coming. To learn more about heart failure, how it is caused, and how it can be treated, go to heart.org. Thank you so much for watching, and we hope you have learned something new and you can share your newfound knowledge with others. Bye! See you next week.